If you're a patient and you get readmitted for the same condition you came in the first place, you would see that as a failure of the healthcare system. As a Chief Innovation Officer at Southlake Regional Health Centre, my main role is to bring technologies to Southlake that are being commercializable and tested in a real-life hospital setting. That means that we get kind of first crack at trying some new and exciting innovations that we otherwise wouldn't get exposed to if we weren't trying them right from the get-go. Innovative procurement is a method by which we try to be a little more open to innovation in the marketplace. Lowest price is not the only determinant of value, and so innovative procurement tries to bring in other factors than just price to the table. The difference between traditional and innovative procurement very often is that in traditional you'd precisely say, I need a pencil 3 inches long and yellow. The only solutions you'll get are pencils 3 inches long and yellow, and price would be the main determinant to decide which one to buy. In innovative procurement, because you'd say, I need something to help me document information, you might get a pencil, you might get a computer, you might get something else as a solution, which would be far more beneficial than having to find pencil in the first place. In innovative procurement, very often people think that price doesn't determine the outcome, but price is one of the factors that is also considered. So it's taking into account price plus innovative potential. Value is the key differentiator there. Value is a range of different objectives that you're looking for. It could be patient satisfaction, could be patient outcome. Price is obviously part of value as well. So could workflow be part of value? It all depends on what your outcomes that you're looking for. An example of a patient outcome would be readmission rate. Patients, the hospital, the vendor community all want products that reduce readmission rates. So in this case, instead of just warranting the product, say the pacemaker, from not failing, a vendor could say, we will guarantee you that we would have a less than 5% readmission rate, and we would all be focused on obtaining that objective. So the role of the clinician in innovative procurement is to participate right from the beginning so that they can have an influence in the types of choices they can make for their very own patients. Many hospitals in Ontario have the belief that the broader public sector guidelines, which oversee all the types of procurements we do, are fairly restrictive in how they're written. In reality, the guidelines are fairly broad in their ability to enable you to do different methods of procurement. Hospitals just have not yet been able to try out the different methods and realize that indeed the guidelines can be far more beneficial than they're giving them credit for. Under broader public sector guidelines, once you set the RFP out, you have to follow those rules through the whole process. So if you don't include a dialogue process in your engagement process, then under that RFP, you would not do that activity. In competitive dialogue, the key is you're re-engaging back with the vendor community and actually getting the clinicians and the users right face-to-face with the vendor, so that you can talk creatively around what possible solutions might exist, as opposed to locking yourself into one solution in a written format in a traditional request for proposal process. The challenges in healthcare are immense, and to me the biggest challenge to not doing innovative procurement is that we won't be as open to innovation as we need. And innovation is the only way we're going to meet the huge demands of healthcare with constrained budgets. If other hospitals are looking to start different projects, I would advise them to read all the material the ministry has put out, but also to seek mentors who have been down the road already and who are more than willing to help mentor other hospitals in how to do this. Our hope is that other hospitals will see that these kind of projects can be done by hospitals in Ontario and around North America and the world, and that they can benefit from them, not just for themselves, but also for the patients that they serve.